Hi, I'm Dr. Hairol Azrin Bin Othman. I'm one of the consultant hepatobiliary surgeon here in Sunway Medical Center. I perform surgery on the liver, pancreas, and the gallbladder, and I also do advanced endoscopy such as ERCP. ERCP stands for Endoscopic Retrograde Cholangiopancreatogram. It is an endoscopic procedure used to treat and diagnose problems associated with the bile duct. For example, gallstone, strictures, and tumour of the bile duct. So ERCP is performed with the patient lying on their belly, face down in a swimming position. Once they are under sedation, the camera or the endoscopy will be inserted through their mouth and all the way into the opening of the bile duct. Nowadays, the role of ERCP is purely for treatment of problems associated with the bile ducts. The diagnosis can be obtained from either an RCP or endoscopic ultrasound. And once we identify the diagnosis or the problem, then we can perform treatment with the RCP. For example, if someone has a blocked bile duct due to stones, what we can do is we can perform the endoscopic and to reach the opening of the bile duct, we make a small cut and put in our balloon or basket to draw the stone from the bile duct. That will relieve the obstruction. So in general, there's a small risk involved with ERCP. It's about 1 in 200 chance or 0.5% risk of either post-ERCP pancreatitis, bleeding, infection, or aspiration. If any of this occurs, then patient needs to be admitted and treated accordingly. So nowadays, with ERCP, we can use a cholangioscope, a smaller scope, which can be passed into the bile duct to view a tumor or any stricture in the bile duct and take a biopsy. So in RCP, if we need to use a stent, the current stent is made of plastic, which we need to remove within 3 months. But with the latest invention of the biodegradable stent, this stent will dissolve by itself within 3 months and avoid the need for the patient to go for another procedure to remove the stent in the future.